All right, let me just 1 second here and I'll get the screen shared. Good afternoon, everybody. Share this. And Julia, do you just want to let me know when you see the full screen?
Yep, it looks good, Michelle.
Okay, perfect. So welcome everybody to this dialogue session. I'm excited to provide just a really brief presentation. And like Julia said, just to really keep it streamlined, we're going to focus more on this double up food box model. And then also at the very end, just kind of show you where we have been in the last couple of years of building out a network to potentially bring some uniformity and cohesiveness to SNAP matching nutrition incentive programs throughout the state of Indiana. So my name is Michelle Shippey. I am with the Marion County Public Health Department, and my current role and responsibilities include coordinating and working alongside my colleagues with nutrition incentive programs here in Indianapolis. The last couple of years, I've also worked with IDOH and facilitating a network of stakeholders across Indiana, specifically interested in this topic of SNAP matching nutrition incentive programs. I thought the first couple of slides I wanted to share and provide just some context for the presentation and provide some definitions and terminology around what we typically are using when we talk about double up food bucks programs. Many of these definitions you probably already know. Specifically, the double up Indiana actually initially started within Allen County. They are a GusNIP recipient, which I'll talk a little bit more about GusNIP in a minute. And then Fair Food Network, they are the actual national organization who started the trademark of double up and the models 10 plus years ago. And then GusNIP stands for the Gus Schumacher Nutrition Incentive Program. And this is the funding that has come from the last two farm bills at a federal level to actually bring some funds into programming, expanding programming, and also really evaluating the programming. And many of you know Hoosier Works, the SNAP EBT program. And then for the sake of the terminology for nutrition incentives, overall, that is a financial encouragement for eligible individuals to purchase or procure fresh fruits and vegetables. This can be within SNAP matching programs, also produce prescription programs as well. Nutrition and security, that's typically a newer term that the USDA is starting to use and provide some definition around, where most of us are used to hearing like food security. But now adding that promotion of well-being and health to it is going to be really important. And these slides will be shared, so I'm not, again, going to go over every single one of these definitions. So double up food programs, they've been going on across the country for about 10 years now. Research continues to evolve, showing very promising outcomes that's becoming very attractive for organizations across the nation. And that's to either implement or expand and grow across communities and a lot of times statewide. So funding for this typically comes from the USDA. And as I mentioned before, in the last two farm bills, it's now known as the GusNIP grant, but previously it was known as FINI, that some of you may be familiar with. And it's really provided that opportunity for evaluation of programming. And in this most recent report from the Gretchen Swanson Center for Nutrition, and just a side note, they are the evaluating organization of that particular funding. And they had their most recent report that continues to show the increased purchasing and consumption of fruits and vegetables, improved food and nutrition security, addresses the disparities to accessing and affording fresh local produce, and also then supporting the local economy from our growers and farmers and even our local food retailers. So with nutrition incentive programs, typically they provide a dollar for dollar match. In this case, the double up model, what that actually looks like is, for example, somebody would come to a farmer's market, they would use their Hoosier Works card at the welcoming booth or table of a market or an information table. And then the double up, they would earn an additional $20. And they come in different scripts, which I will mention in a couple slides here. So then that participant receives a total of $40. In farmers markets, at least for us here in Indianapolis, we do up to $20 per day. We're actually moving the $20 to farm stands and CSAs as well into next year. And then on a retail setting, we'll do up to $10 per day match. A lot of that has to do with funding because majority of people are shopping at a grocery store. And if we are doing higher amounts of matching, the money will just run out too quickly. And actually, Michigan started seeing that a little bit, and they had to stop their earns until more funding actually was gained. But how they can spend those dollars then is with the SNAP dollars, they can use that on any SNAP eligible food item, bread, grains, produce, dairy, any of those items. And then with the double up that they earn, they would use that for their fresh produce to really incentivize those households to get healthier foods for their families. So what the incentive models actually look like that are supported by the USDA, within a farmer's market, they're all typically $1 for dollar, a SNAP to fruit and vegetable with farmer's markets. And then within a retail and farm stand and even a CSA, it really depends on the point of sale systems that are available, but it can be $1 for dollar match, or then it can also be like a 50% off discount. So if the point of sale system has the functionality of putting a coupon in, and those will usually either do a fruit to vegetable match, or even a fruit to vegetable to SNAP match. So if somebody went into a store, purchased fruits and vegetables with their SNAP card, then their match would actually go towards any SNAP eligible food items. And so those are the three models that, at least here in Indianapolis, we typically are gearing around, excuse me, and just aligning with the efforts that are happening at a national level. So when we talk about script, meaning the currency, for SNAP, those usually come in the form of tokens. Some markets may do paper vouchers. I've heard in other states, some will do like tickets, coupons, things like that. And then the same for the double up. You have tokens as an option, which would be a different token to identify it, a different paper voucher to identify it. And now the most up-to-date versions is within this e-token, e-incentive piece. Now, keep in mind with SNAP, e-token is not an allowable script to be utilized. The USDA and FNS, they're against it at this point. So here in Indianapolis, what we do is we still provide tokens as the SNAP currency, and then we load the benefit of the match onto a FreshBucks card, which is identified as an e-incentive. And then our farmers and growers are able to take that card by scanning the back with their phones through an app that we helped them get. So the one thing I did want to just really emphasize and sort of end on with this presentation is why more fruits and vegetables, and why it's important that we try to keep this at the forefront. Americans do not meet the recommendations of fruits and vegetables. And if you're familiar with the Healthy Eating Index, the score is actually an average American is seeing about 56. And for fruits and vegetables, way under recommendations. Total grains are typically met within recommendations. Unfortunately, not the right grains. We see a lot of we see like simple sugars and those sort of grains that are being consumed versus our whole grains. Dairy, we are actually a little bit under as Americans. And then protein items, we're at recommendation and even above on that. And so if you get a chance, you can go and look on the website. I put the resource at the bottom there for what the Healthy Eating Index scores are. So I don't really have to tell you guys on this either, but why eating more fruits and vegetables? They're good for us. They are full of micronutrients that actually help us manage and prevent chronic diseases. When we look at the different health disparities, especially within our underinvested communities and our communities of color, where we're seeing higher blood pressure, higher rates of heart disease, higher diabetes, I think it's really important that we understand that we have to focus too on making sure that these healthier foods that we know promote good health are becoming available and affordable for everybody. And so in conclusion here, health promotion, disease prevention and treatment, they're affected by a wide variety of factors. And the ability for individuals to engage in healthy behaviors, they're impacted by their environment, which ultimately shapes policy. And so some of these policies have caused systematic disinvestment, perpetuated racism, poverty, inequities. And the ability to choose healthy foods is impacted by, social determinants of health and transportation. Is there proximity to full service grocery stores? Because here in Indianapolis, our farmers markets are only in particular communities. And so us expanding into retail setting is extremely important. And so this slide just shares the data about the relationship between diet quality and chronic disease. I also do want to acknowledge the complex reality that we also know there's behind food choices as well. But diet is the most significant preventable cause of chronic diseases. And at least, seeking and addressing the cost as a barrier to purchasing and consuming fruits and vegetables for SNAP users is extremely important. So I am just going to end then on this actual slide to give you an idea of, in the last couple of years, where we've been moving and sort of building this network. And some may have already seen this before from a previous presentation, but in 2019, with IDOH starting the SNAC group, there was a questionnaire that was sent out to all the members. And there was 3 priorities that were chosen. One was to create this uniformed statewide marketing campaign for Double Up Food Bucks. So then we had to back up a little bit and say, okay, well, we don't even have uniformity to any programming within our state. So it's going to be really difficult for us to do any kind of marketing campaign. So that really helped us think about facilitating stakeholders and pulling people into monthly meetings. And then in 2021, through our REACH funding, we actually had a consultant from Wholesome Wave come and do some stakeholder interviews around the state to see where our capacity may be at. Looking at whether there's an organization in our state that could potentially house a statewide program, or do we need to create a new one? And there's still lots of questions that we're trying to create, which I think hopefully this dialogue session and our soon to have breakout sessions will be able to kind of dive a little bit deeper into that conversation. And then in the last year, we have sort of revitalized the group, mentioning as the Indiana Nutrition Incentive Network. The network can definitely carry different arms, but in the sake of really staying focused on one particular program, for us is extremely important. And really building off what a Double Up Indiana model could look like and infrastructure could look like here in the state of Indiana. So that is the conclusion. Hopefully I stayed within my 10 minutes. Julia, I'm going to send it back off to you for the discussion of the breakout sessions.